Hey, welcome to the Zenway podcast. It's another episode, and I have a dear friend who also is a fellow podcast host as well. Her name is Sarah. I'm your host, Zenway. And on this podcast, I talk about life, career, and tech as well. So in this conversation, I have a good combination of all those three things. We're going to talk a little bit about life as a mom. We're going to talk about her career in Silicon Valley in one of the health tech unicorns as well, right? So we're going to touch a little bit about health tech as well. So super excited. We got connected over LinkedIn. It's been a super rewarding platform so far. They're not lying when they say LinkedIn is the cool platform right now, in terms of really connecting with people, right? So, without further ado, I'm just going to welcome Sarah to the show and ask her to introduce herself. Hey, Sarah, welcome on the show. And, tell us a little bit about yourself.
Hey, hi Zen. Thank you so much for having me here. Yeah, my name is Sarah Wong, and like you, I am a budding podcast host. I'm a Singaporean. I am a mother of two young kids, 3-year-old and 1-year-old. I graduated with a Bachelor of Science in Economics in Singapore. Quickly found my way into healthcare in Singapore and later in Silicon Valley. And I recently returned to Singapore last year after about 6 years overseas. I was studying, doing my MBA, and then I worked in the US. So today, professionally, I split my time between two main things. I am a consultant with a med tech startup / incubator community called Heal Venture Lab. And I also do this podcast called Make It Work. It's about working moms in Asia who have made career shifts whilst keeping family first. And personally, I spend a lot of time with my family of young kids and also very involved in my church community. A fun fact is that I am married to a pastor, and that can be a topic for another day.
Yeah, I love that a lot because my son just turned 1 year old a week or two ago. So
Congrats.
thank you.
Congrats
And
to the parents,
obviously
actually. That you
we
survived 1
survived
year.
1 year.
Yes, I think it's more for the parents.
Yeah,
Sure.
it's very obvious when they're like, you sing happy birthday to them, they have no idea what's going on.
Oh,
But it's so
okay.
cute to kind of see them exposed to this kind of I guess birthday celebration, and like now that he can walk around and all that, it's really fun to kind of see him playing with different birthday gifts as well. But really I really like what you said around put working mothers and also putting their career first as well, because when my wife was
Family
going
first.
through.
Family first.
Yes, family first, right? Family first. And sorry, my bad. And when my wife was going through, her own maternity, she was also, discovering her identity change as well. There's
Yes,
always this battle between, do I want to be a stay-at-home mom because I miss my kid, versus I still want to have a career as well, right? So I listened to a few episodes of your podcast, and I find those conversations really interesting to try to understand the perspective of women as well.
Thank you.
So let's talk a little bit about your background, right? Before the show, we talked
Yeah.
about how it was an interesting journey for you to kind of reflect on as well. So you
Mm.
mentioned that you studied economics and political science as well,
Yeah.
right? What made you chose those those majors in the first place? Let's start with that, right? And then because after that you took such an
Sure.
interesting path as well.
Yeah, sure. So that was actually quite some time ago. That was in 2005. And I initially applied because I think I wanted to broaden my options. Actually, I applied to business school. I applied to Singapore Management University Business School, and it was pretty new at that time, maybe 5-6 years, and it was known for its business school because it's supposed to be the NYU of Singapore. It's the university in town, and you're supposed to have a lot of good connections to business leaders and things like that. So that was how it tried to differentiate itself between the other Singapore universities. So I was attracted to business initially. Then the
Mm.
interesting thing is, and I will answer your question very quickly, but when I was reflecting, I realized that this started a journey of basically learning how not to accept no as an answer. So I went for the interview, and that time they had these panel interviews where students were supposed to be really very vocal and talk about
Yeah.
current affairs, talk about your ideas,
Yeah.
raise your hand, talk about the latest and the greatest in business. And basically, I don't think I shined. I don't think I made the first cut. So I didn't actually get accepted the very first round. They have like these rounds of acceptance. And then when I didn't get my reply from the business school, I started kind of wondering, and I was a little bit afraid that I wouldn't actually get in. And so I preempted this and I wrote into, I think, the dean of the school to ask for sort of like a one-on-one presentation to tell them
Wow.
and convince them why I should be accepted. So I talked about some of the charity work that I was doing. We were at that time raising a lot of money for this charity in Singapore, and it also brought us to Zimbabwe for a humanitarian trip, which was very interesting. And I basically got accepted there and then. So I got accepted into the business school after sort of being waitlisted, I suppose, not officially. And then why I went into economics was just a senior that I met in the School of Economics who somehow brainwashed me to say like, hey, economics is much more broad. You actually get to
Yeah.
learn about the science or the math behind it. And I actually quite like economics back in my junior college days. So I don't know. I got tricked into it, I guess. But yeah, all good, all good.
And was the same senior did the same senior also kind of convince you to also take up political science as well, because it's not something that you naturally take up out of naturally, right? Because you went for business
Mm.
economics and suddenly there's political science as well.
Well, I think there were quite a lot of overlaps in the schools because the School
Mm,
of Economics was actually housed together with the School of Social Sciences, in which
right.
political science is a major. So I had a lot of friends who were in the social sciences, and then they would talk about their courses, and obviously we would also have a view into the different options, and things
Mm,
like globalization of the politics and just the political science modules were incredibly interesting to me as well, to kind of make sense of the history of the
mm.
world to, I guess, sort of crystal ball gaze. And I thought that would be a good way to kind of piece the econ side and then the history side together and understand the world better.
Yeah, and that makes a lot of sense because I think economy is very closely tied to political stability and things like that. Us in
Mm-hmm.
Malaysia, for example, every
Yes.
single time. I mean, we changed our governments like 4 or 5 times in the last 2 to 3 years, so
Yeah.
we know the full effect of how political stability can actually affect economy stability, and it also in general it's just perception and sentiment, right? Because it's all about that, right? In terms of how people perceive our economy going forward. So I think that makes a lot of sense.
Yeah. Yeah.
In terms of your first few roles, right? How do you land your
Yeah.
first few roles after that? Because it was rather interesting that you went into this innovation
Mm.
space as well, right? What did you take away from those chapters?
Sure. So I think I can break up my career journey into three big parts. I think the first part was my foray into consulting and uh, market analysis and market research. These were non-healthcare related jobs. I was
Mm-hmm.
in a business Monitor International. It was like a market research company. I was doing commodities analysis, which was totally not
Yeah,
related to
yeah,
healthcare.
right.
But
You're
these
related
are
to
transferable
economics, right?
skills. Yes, exactly, exactly. So yeah, I
Yeah,
guess that was where I was
yeah.
writing off my econ, my degree, and I joined a graduate program. And then from there, I learned how to read like Bloomberg charts. I learned how to
Mm,
make sense of the prices of soybean and how the demand and supply, because of weather problems in Ukraine or in China, would actually affect the prices of these commodities, which is an important asset class. And also, I guess it helped me also give me a grasp of financial markets a little bit. And importantly, it gave me research skills. So I, had to write these reports every day, essentially, read, business articles and more long form, like quarterly reports that were essentially, a very transferable skill that went into and served me well in my consulting role. After that, it was a strategy consulting startup that I joined, and really, so after that, I went into my, I guess, the second phase of my career, which was really into healthcare. And it was in a corporate innovation team, like what you were alluding to, an innovation team in Medtronic, which is one of the largest medical device companies in the world. It's based in the US, but they were starting out this very interesting business model innovation group in the organization. How I found out about it was through a mentor. And yeah, actually, one caveat I wanted to say is that out of all my, 5, 6 jobs so far, I think only one or two have actually been found on the official job portals. Like the rest were actually found in what you would call like a shadow job economy, which from what I understand is actually majority of the jobs, basically the ones that aren't,
Yeah.
officially, advertised. And so they were all like referral or through people, right, that I hear about, and then start like getting into. So yeah, so that's one caveat. Yeah, so from then on, all my other roles were basically, through referrals. And then I went into health tech because of my experience in Medtronic. I had the really privilege to sit, that time it was 2012, 13. And this is where I met, who was one of your guests in your podcast before. Yeah, she was the manager who I mentioned had introduced me, and I had the privilege to really sit at the front of this whole wave of like the quantified self movement, and data being a really exciting prospect of measuring your kind of lifestyle and thinking about how it would augment how people took care of their health and the approach to healthcare. I mean, bear in mind, like the Apple Store only came into being like 2 years ago, like 2010 or 2011. And so, the apps started coming out and it was still super new. So with that, I got really excited about like, oh, wow, what could, tech really do for healthcare. So that's how I kind of delved deeper into health tech. And then the last biggest experience was in the US in working in, I guess, the sort of the heart of innovation in healthcare and health tech. Yeah.
Yeah. And after like being in the in Medtronic for a bit, and then it seems like it's kind of paved the way for the next health tech roles as well, right? So you have another role in, I think it's Connection Asia, from about 2012 to 2016. You've mentioned around like how iPhone and the App Store just came out as well, right? And then up to 2016. What are some, I guess, during that time, what are some of the, I guess, the trends that you observed that was happening in the industry? Were people going more, I guess, mobile, or what was the trend you were observing at that point of time?
Yeah, definitely. I mean, I think that was where the shift into your phone being your personal computer like really started. And so yeah, as I was talking about the whole quantified self movement of using your phone to start tracking you and helping you with reminding you that you needed to move around. I mean, I think that still it wasn't that advanced at that point, but I mean, that was what people were saying that would happen one day. And I was like, oh yeah, that's totally true. And so one of the projects that we did in Medtronic was around helping diabetes patients basically monitor their condition when they left the office, right? So it's a chronic disease. It's something that is going to be there for a long time. And it's really about healthcare management and not about the time when you go into the doctor, right? So it's, between the first and the 6th month when you have to have your regular checkup, what happens during that time. So the idea was that, okay, we can use these apps to help like prompt or have a way for care coordinators to reach out to the the patient, or for the patient to also reach out to the doctor or some kind of healthcare professional to ask if they have any questions and to manage their disease better. So this really laid the foundation, though I mean it must be said that it was super early on. And the interesting thing is we pitched this idea of using these apps wrapped around like a continuous glucose monitor, for example, something that you have to put on yourself to monitor your blood sugar level.
Yeah.
We pitched these to local Singapore stakeholders, but this is the environment here is a little bit more risk averse, and in the end we found the most ready to trial kind of counterparts in the country like India, where they can do well. They have much more, I guess, flexibility and freedom to try out these things because it's slightly less regulated, and people were just more, I would say, like open to trying new technologies, especially then. So those were some, I guess, interesting observations. And then come to the insurance tech. My work experience in Connections Asia, it was also because I wanted to see, and that was where people were saying like, hey, insurance is also the next frontier, because they are essentially the most aligned in a way with the actual patients or the customers, because they are the ones who have to pay for it eventually. So it's in the insurance advantage, the insurance company's advantage, to actually try and experiment with these products, right, to see how they can keep premiums, without ballooning, and keep them, the better way to kind of stratify, or what you call like prioritize certain populations and have more tailored like insurance plans. So that was kind of why I joined it as well, because it was a different stakeholder in the whole healthcare ecosystem. I was in a med device setting before that, and then I decided to try out this insurance tech, because they were also much smaller than Medtronic, and they were a different player, and and importantly, they also were willing to take on somebody who didn't have any tech experience. So that was a really important caveat, I would say, that in my experience in joining that company.
Yeah, I think you pointed out a few really interesting parts where, in terms of insurers they are more aligned to the consumers or the end users, because it is in their interest to keep you healthy, because then there's less claims. It is also in their interest to also kind of lower down the cost as well, because they do not want to have their costs gone up as well. It's a rather interesting perspective, because there's always this stigma where I'm paying a lot of insurance premium for nothing, right? So but I think there has been a change in the industry as well. We've worked with in my past organization, we worked with insurers as well, and they wanted to innovate in the sense that they want more engagement. That's what we've been seeing, right? For the insurance player, they do not want the relationship where it is at the touch point of them buying and claiming, right? In between, you don't hear from them, other than asking you to buy more premiums. Right now, they really want to make sure you feel like you're part of the I guess like a real customer in a sense, right? We're gonna give you different perks, different benefits, and stuff like that before you even claim or have a serious health issue, which is a very refreshing change, I must say, because we run a family, and how many insurance policies do we really have, right? So it's really quite a big sum, and you always want to extract more value out of them as well. I'm curious in terms of the I guess the innovation that you see when you're working with Connection Asia. What are some of the interesting stuff that they have actually tried to kind of make things a bit more different and innovative as well in the insurance space, right?
Well, that was, I would say, 5-6 years ago. So that was a while back. I think it might be a bit different today.
Of course,
But what I saw, in the insurance business, like what you mentioned, it was the budding of interesting ideas around like, okay, let's have the innovation, let the insurance companies were trying to have innovation disrupt their model in a way. So there were a lot of these innovation labs coming up, in many of these insurance companies, which were focused on, like what you said, trying to increase the touch points to ideally maybe have more personalized policies or for these customers. So that was one. And if I may, I think I remember looking a lot in the US, because that's where usually this innovation kind of starts out first, right? And then it slowly trickles. So there were, these, in the US, they have these employer plans, right? So you have the huge Apples and Googles. They're actually, they insure their own population because they are so big that they have the pool to, essentially sort of balance out the risk. And ideally, these are also more healthy people. So with that, they had unique plans where they were set up with some startups like some diabetes management, for example, companies like Omada, Livongo, where they would have specific, plans for patient or for customers, employees who had, say diabetes, or maybe they're pre-diabetic, and they would sign up, and then they would get this package from the company to help with managing your diabetes. They'll get like a weight monitor, a smart one, a Bluetooth one, and then they'll have a health tracker. And then so these data points, if they were adhering, it would actually help to track how they were doing, say, with their weight management, and then ideally translate into, after a while, translate into better outcomes when they did this HbA1c or their blood glucose testing every few months. And they would even have and actually some of these companies were so interesting that they would have these value-based contracts where the companies would only be paid if there was any change in the these metrics, like if the sugar level actually went down for your employees. You would actually be paid. So those were really innovative payment models, I guess, in the insurance space that caught my attention for sure.
Yeah, I mean, you mentioned one that we're probably going to talk a little bit more later, which is the value-based healthcare. But before we take that tangent, I wanted to explore one chapter in your life as well, in terms of in 2016 you decided to actually take an MBA, and I would think that at that point of time, looking at your trajectory, you're probably on the way up, right? And taking an MBA would meant that you probably need to kind of focus a little bit more on that. So I was curious in terms of, was it a full-time MBA? Why do you decide to take an MBA? And I guess how did that influence your career or affected your career as well, by taking an MBA?
That's a great point. I remember at that point I was in Connection Asia, and I was basically in a very young and very high potential startup, and I was thinking about, okay, what am I going to lose out if I were to step away from this great opportunity into the INSEAD MBA, which would be a 1-year thing. It was a full-time thing that I had applied for. Honestly, I didn't really think about part-time. I think I wanted the full experience, the immersive experience. I think I read a lot about how it would be really hard to juggle between studying and working, and I was in a startup. So at that point, I didn't think it was the best idea. So it was between continue the startup or leaving to pursue the MBA, and different things, I guess. I mean, you make the best decision that you have with the information you have then. And I remember it was some of the mentors that I had in my other companies, they all had some form of masters, and I always looked up to them. I thought they were the smartest, the most well-traveled, and really had great experience. Even though they weren't that much older than me, they had just a really new perspective to working, which I hadn't experienced, working, studying, because I was still quite young then, as a fresh graduate. And so I kind of boiled it down to their global experience, having done their masters or MBAs overseas. And they always talked about their MBAs with glowing eyes, like, oh, those are the best years and stuff like that. So that, plus I guess the last piece that I knew that I always wanted to work and live overseas. So I saw this as in a way a ticket to do that. And I mean, for sure, the INSEAD MBA is also a great platform. It is a very well known and a very solid program. So I didn't think I would be ultimately, if I went into, which I did, that I'll be really missing out on that much, essentially, because the ROI from the MBA was pretty tried and tested as well.
Yeah.
Yeah.
And in terms of you talk about how that's the ticket for you to work overseas and stuff like that. I think
Right.
it definitely did, right? In terms of looking back in hindsight, hey,
Wow.
it kind of planned out, it kind of worked out, So what was it really like, working in a startup in the Silicon Valley, right? How do you kind of like adapt to the culture over there? We always hear about all this stories around how fast paced, how talent dense it is, how eye opening it is, right? What was your experience like?
Yeah, no, when I think about it, I kind of take a deep breath because it really felt like I was in a different world where time speed was, 1.5x or something like that. Like things really move so much faster. I also want to think back about when I started to actually look for a job, because it wasn't very straightforward for me. I'm not American. I didn't study in the US. I did a study exchange during my INSEAD days with Kellogg, which is a business school in Northwestern, which is based in around the Chicago area. So I was exchange student, and the tricky thing about US is, well, and in most countries, like in Singapore also, you need to be authorized to work. So I remember having a lot of conversations with these startups that I would meet when I was an MBA student going to graduate, that they would first ask, like, okay, do you have work authorization? And then it's a yes no question, and my answer is no. But I always try to kind of like, yeah, not really, but and the fortunate thing for me as a Singaporean is that we do have this special visa status, where it makes things easier for companies to employ Singaporeans. But that said, these are startups that I was talking about, so most of them didn't know about this program. So I had to do a lot of basically being very thick-skinned, like sort of trying to educate them about it, like not sounding like, hey, you got to know about this, but more like, hey, actually there's a really easy way. And then I send them information, and it was basically I was hustling, right?
Right.
So I wanted to talk about this story, right, where I was in where was I? I was in California. I was in San Francisco. I wanted to go for this healthcare conference that one of the universities organized. I was there, but it's really expensive to find a place. And I was a student, a poor MBA student with a lot of debt, and I basically couch surfed for, like, I don't know, 2 weeks or something. I just asked friends of friends, and I one day I it was on one of the couches in these tech bros. They're like really dingy apartment, and then I was thinking, oh my gosh, I just realized, I'm like, I'm in this house of two strangers, two guys that I've never ever met. What am I doing this? I was like, oh my gosh, does anyone know that I'm here? That kind of thing. It could be a potentially dangerous situation, but I guess I was at this, like you said, I was thinking about, okay, this is my one chance. I have to really try to maximize it, and that's kind of what I did. So I tried to minimize my costs by staying at these places, and then go for these conferences to meet people and potentially find something. And I mean, it worked out. It thankfully it all worked out. So those were crazy times. And okay, to answer your question about like the vibe, right? It was, again, crazy fast paced. This was before COVID and all the tech layoffs, right? So this was the heyday, and like when people were hiring left and right. Like I would walk down the street, and all I would be hearing are these conversations, and people talk very loud for some reason. They were talking about, oh, I'm raising funds for my company. I'm going to I'm running to this VC whatever pitch thing. Like you could literally hear these conversations happening around you in Pete's Coffee uh, yeah, walking down like Mission Street, or it was just uh, in the air. Essentially, I took an
Mm.
Uber then, and I remember the Uber driver like basically pitching to me. She was like, "Oh yeah, I'm doing this right now. I'm driving now, but I'm doing this startup. Here's my card." I was like, "Wow, okay." Every single person has like a side
Yeah.
thing running some kind of startup.
Wow.
I
Yeah.
was, yeah, just kind of thrown into a totally different world,
Yeah.
like I said. So
Right.
yeah, it was very exciting. But at the same time, it gets to you. It's like, oh no, I don't have anything, or like I need to work in a tech place, and
Yeah.
so there's a flip side to that. Yeah, for
Mm,
sure.
right.
Yeah.
I wanted to take a slight tangent to this, right? Because, at the top of the show, you mentioned around like, having this, say no, not taking no for an answer kind of attitude. And in terms of like,
Yeah.
you going to the, and you going for your placement even back then, right? Trying to get a placement in SMU and stuff like that. You already
Oh
started
yeah.
hustling back then. And then now, talking about this story, you started hustling again. I wonder,
Oh my gosh.
where
Yeah.
did that come from, about you, right? Where did that come from for you? Is it something that
Yeah.
perhaps, an experience that you had earlier in your life, or what do you think it was, right? Or maybe you're just like competitive, I don't know.
Yeah, that's a really good question. Um, yeah, I mean, I guess it's partly, yeah, well, definitely my family upbringing is one where, uh, not, I wouldn't say that it was very competitive, but I think for the most part, especially my mom, she's had a big influence in my life. Like she's always been a self-employed person, and she
Mm,
was an insurance agent. And I think with doing insurance, you have to kind of be that way.
yeah, have to be
Um,
resourceful, right?
yes, exactly. And then she switched jobs midway because she felt she was getting kind of stale into real estate. And whereas, I
Mm,
mean, she was also, essentially selling most of the time. And I think I kind of got that from her. Um, Also, the first time always gives you confidence for the next time, right? So with
mm,
the SMU experience, in fact, even with INSEAD, I was also on waitlist. So I also had to, try to differentiate myself. And I basically also had to add in more information, look for more resources or people to give me referrals. And once you do the first time, you do the second time, you're like, okay, actually, the first no isn't an
always a
absolute
definite
thing.
no. Yeah.
Yeah. You need to find a way to make yourself non-irritating. I think, like really appealing, right? Like I
Right.
remember, okay, one of the things I did was in the conference, the one in SF that
Yeah.
I captured in.
Yeah.
I wanted to talk to this startup like founder very much. And I was thinking, how do I get to him? And then for some reason, I was going to the restroom. He was there, and I was like, oh, it's my chance. I don't want to, sound like I want to draw per se, but what I had prepared beforehand, that's really important. You need to prepare, right? Was my kind of pitch. I was like, hey, I'm an MBA student. I was wondering if your company would be interested in, doing some kind of special project about, expanding into Asia, because that's my thing, right? So I'm Asian. I have health tech experience there, and then like I guess he knows I'm a student, so he doesn't pay me. And then like, oh, why not a free project? Like, sure. So that's how I kind of scored a project with the company. And
Mm.
yeah, so it takes both sort of that luck thing, but prep for sure as well.
Yeah. I mean, I
Yeah.
like the saying of increasing your surface area for luck to stick. So that's kind of what you did, right? In terms of
Yeah.
just really trying different areas, and luck will probably be present in some of those things. So it's really fascinating to hear these
Yeah.
stories, right? And
Yeah.
it's very encouraging
Yeah.
for those who are really just wanting to kind of try different things, right? You really never know. I think it is also a good reminder for me to also try to kind of invite guests that I want to be on the show as well. A lot of times until
Yeah.
today, after even like, like how many episodes in, I'm still finding myself, hesitating to write to this person that I do not know as well, even though, hey,
Yeah.
the worst case scenario is just a no. And like you say, the first no may not be a definite no. Why not you just follow up again and again, right? So,
Yeah.
that's really interesting. Let's
Right.
kind of shift gears a little bit in terms of the question that I thought that I said that we were going to touch on later, which is value-based healthcare.
Yeah.
This is really interesting to me because we've been talking
Mhm.
about it for the past 3 years as well. I kind of explored this a little
Mm.
bit with Pin as well in terms of
Mm.
what that could potentially mean as well, right? Because value-based healthcare, I guess to kind of set the stage and set the frame is really that it meant that I will pay. It's a payment model between the payer, which most of the time are insurers or even yourself, and also the healthcare
Yeah.
provider in terms of if you can make a change or a value, then I will pay you. It's kind of like that payment model, right? So it could really change the way we see healthcare, because right now in Malaysia, at the very least, I guess in Singapore as well, we're rendering service based on the time that a professional give us. Like, for example, mental health
Yeah.
professionals, you see them for an hour, you give them a certain amount.
Yeah.
Professionals as well, medical professionals as well, you pay them per consultation, right? So
Yes.
I'm not saying that medical professionals are evil or whatever it is, but sometimes they are bad actors that could actually are incentivized to keep you coming back again, right?
Yeah.
And that's not actually always,
Mm.
I guess, a clear indicator of the health quality that you bring.
Yeah.
So I'm curious
Yeah.
in terms of like, when you talk about value-based healthcare, overseas, and also perhaps what you're looking at here when you're advising startups as well. What is
Mm.
it? How is it different? Like back then and now. What are you seeing as well?
Yeah. Thanks for that. So, firstly, I would, give this simple analogy to really
Mm,
make it understandable.
yeah.
So today, most of the healthcare system they are in is that we are paying the doctors, the hospitals for the kind of services that they render us, and so that's how these healthcare, the whole healthcare provider group in one, um, as one collective, is being paid and thus incentivized. What value-based healthcare tries to do is to essentially change the way that it's being paid to basically encourage these providers to keep your patients outside of the hospital. So think
Mm,
about it. Today they are being paid because you go to hospital, but what value-based care is trying to do is to pay them to keep you outside, right? And that's
mm,
what I want, right? As a patient,
yeah.
I want to not go to hospital, right?
Yeah.
That's the thing. So there's, I guess, like you said, this mis sort of alignment of incentives, and value-based care is so unique because it's trying to align these very, on a superficial level, like seemingly unreconcilable kind of incentives.
Mm,
So how we think about that is, for example, in the area of preventative health, that's the most obvious. And in the US, it's where it's tried and tested, right? There are certain kind of things where if you pay people to do, or providers meaning like doctors, healthcare groups, to try to get patients to come in to do, people to do like screening of breast cancer, cervical cancer, colorectal cancer, um, and vaccinations itself is also a form of preventative health, right? There is a lot of benefit down the road for everybody. And the way to be able to do that, you need kind of three ingredients, right? You need these policies, you need to have the know-how of what are the things that would move the needle to essentially reduce or keep costs not ballooning, or keep costs low for future generations. You need to have this understanding, and it can be slightly different for different populations because there are genetic differences and things like that. But at the very base foundational level, things like what I just shared, those screening things, um, have been universally acknowledged, and you need to have those in place. And then the second piece is that you need to have the right kind of payment incentives, right? You need the governments to step in to be able to provide dollars to move people to come in and do mammogram screening after 45 years old, and then do regular follow-up. And the base kind of layer for that, and the third ingredient, is really the data interconnectivity. Because to do this well, you would need to be able to feed data from the patients. You need to understand, oh, this lady is 45-year-old already. We need to encourage her to do that. How do we even know that we need that information, right? The doctors will need to have that. the insurance also ideally would know that, right? And there's a way to then reach out to them and then collect that information and put it into a place where you get a holistic view of Sarah Wong as she grows older, has 2 kids, and understand like what are the different changes the patient is going through, or the customer is going through in that sense. So so the 3 things, right? The right framework, the understanding of what kind of policy or population health management levers are important for your population. You need the payments that will be aligned, and then you need the data. So with these things in mind, I guess we need to then think about which countries are, where are they in these three areas,
Yeah,
right? To
maturity
really
level of each
effectively,
of those
yeah,
areas, right? Whether you're ready in each
exactly.
area, right?
Yeah, to effectively kind of roll it out. And I want to bring up something interesting that I came across in the US. So, US started this in the early 2000s, where they tried to basically, well, they made a law to make sure all hospitals or all healthcare settings have now a EMR. So today, everybody is on electronic medical records. This is
Mm,
not the case, right, in Asia, in a lot of countries. Yeah,
yeah.
but because they started with that, then they could, layer on different things like the different policies and the different programs like the Medicare Advantage that we see right now, which is the equivalent of, Medicare itself is equivalent of like a national insurance for people over 65. And an interesting trend came up that since I think 10 years ago, 2010, the spending of Medicare, so this is insurance for 65-year-old older folks, has been quite flat for the past 10
Mm,
years. And you don't really
wow.
hear about that. You hear about like, okay,
No.
yeah, healthcare cost is really big, but Medicare per beneficiary, so individuals, in the healthcare system in the US are actually having very negligible like increments, like
Wow.
there's inflation and stuff like that, so you take
Yeah,
that
for
into
sure.
consideration.
Yeah.
And yeah, this is amazing chart where the predictions for that is going to be like skyrocketing, but actually in fact after 2010 it kind of like just
Flatline
is
just a little
flat.
bit. Yeah.
And I mean, no one really understands this, and there have been like different reasons why people come up with it, but I think one of the reasons is also definitely because of these policies where people are in a way more incentivized to manage their health more preemptively. And so I think that's a hopeful kind of note for us here in Asia, right, where we are admittedly, much less mature in these 3
Mm,
levers. I mean, it's not to say that US has it down for sure.
of
Like there are
course.
a
Yeah.
lot of challenges, and it's pretty broken as well, the
Absolutely.
healthcare system
Yeah.
there. But yeah, with regard to this area of population health and value-based care, I think it's a hopeful note. And we see, recently in Singapore, there's this whole healthier SG where now the government is saying, okay, we're gonna, make it free for people over a certain age to do these regular health screenings. They're gonna go into, so that's number one, right? That first level that I was talking about, the policies. And then the second thing, now they are doing these capitation models. So essentially, capitation is about giving X amount of dollars to a certain healthcare provider. And we have 3 like public clusters. So they all have these mandate to take care of a certain population in their region, to make sure that they are doing the right kind of screenings, not going back to the hospital if they have been discharged from some kind of procedures. These are all the different ways that they're trying. And I think a lot of countries are trying to go towards this data integration by building up their own, national record, right, of healthcare
Mm,
data.
absolutely. Yeah.
So yeah, I mean, I think yeah, with that, it's all in different stages, but everyone is working at it, right, in different
Mm,
ways, at different paces also.
yeah.
So yeah, it's hopeful. I would say it's definitely hopeful. I'm excited to be,
Yeah.
back in Singapore in this region during this
Yeah.
exciting time.
Yeah. I mean, when we were, I mean, Thoughtful has a HQ is in Singapore as well, right? So we do actually
Yep.
interact with, the parts of the ecosystem, and they've been talking about interoperability of healthcare data as well.
Mm,
Um, that admittedly is going to be a challenge because everybody don't trust each other with each other's data. So that's going to be a little bit of a challenge. But I think that the nuance to that is really like, what do you need at what time, right? It's not an open book where you can go in and just take whatever you want. It's about how do you then create systems and rules where you can only take what you want, right? I can share with you, but you can only take what you want and state the reason that you want. I think that's a good place to start, rather than assuming that it's gonna be this open book database that everybody can just look it up, right? That's gonna obviously gonna spell a very good recipe for disaster, right? So you've mentioned that you're excited to be back in Singapore and all that, and of course that also kind of prompted you to start the podcast. So tell us a little bit about the story behind the podcast as well, right? Obviously we had a chat off camera, but let's talk a little bit about that story, right? Why did you start the podcast? Maybe you've introduced it briefly at the top of the show. Talk to us a little bit about, I guess, the guests that you had on the show as well, right? So far,
Okay, I mean, it's not a very long story because I just came back last year. But it was really when I came back, I had been overseas for 6 years, and I was essentially pretty burnt out from 5 years of intense sort of startup life, and I also had a 18-month-old, and then I was pregnant with number 2. So with so many changes on the horizon, going back to your culture, there's also this thing called like reverse culture shock, and it's real. It was really real. That I was in this place where I asked myself, hey, okay, so what am I gonna do after my kid is out? Do I still want to continue working? I was still working with my the US company at that point in time. But at the same time, there are all these interesting things happening in Asia, right? But it needed some time to get back and understand, catch up, right, with what was happening. So I thought to myself, hey, okay, let's do this thought experiment. What about if I didn't do anything for a while, take time to readjust all that, having a second kid, no joke, right? And then just so many things that we had to adapt to again. Even the payment systems were different. So I was thinking, okay, how about I talk to 20 women to understand how some of them have kind of made it work, right, with having young kids and still wanting to be very involved in their career, because I knew that that's what I wanted to continue on, though not in the same way as before. So I was essentially trying to find a new way of being, and so that's where the idea was birthed. And then I had these conversations. They were so interesting that I thought, hey, other people might be able to benefit. And since I have the time and space, why not try something new? I always wanted to do a podcast because I started to listen to these a lot during COVID, as I think many of us did, consume content through podcasts. And like, apparently it was quite easy to do, right? So I decided to take up the challenge.
Evidently, we're here. Two budding amateurs, like doing our own thing.
Gosh.
It's really theoretically very easy, but practically speaking, it does still take a bit of a motivation and push from yourself.
Tell me about it. Every time it's like, okay, and so I do it every other Wednesday. I have it in my calendar, right? I'm like looking at it and like, oh dang, I need to prepare, do the post-production stuff properly and all that. So it's also definitely why it's been keeping me on my toes. For sure. And it has led to really interesting conversations and new ideas. So you were asking about, the kind of people. I think also one of the things that I've noticed is that there's, an increasing shift in the way of working. It's slowly but surely towards the idea of maybe a bit of like a portfolio of your career rather than like a career ladder. It's like a portfolio where you have different ways of essentially monetizing your skills. And it was because of the people that I met that I started to learn about this whole area, which I guess can be categorized in future of work kind of thing.
I noticed that as well. Like, it seems like I spoke to a few recruiters as well, right? And they seem to be saying that could be the way forward until there's some semblance of economy, positive sentiments on economy, U-turn or whatever jazz they call it, right? But it's really interesting.
I think it's here to stay. I think it's
Yeah,
here to stay.
absolutely. Because everybody is so burnt out for the past few years.
Yeah, with
People.
tech layoffs, you realize like, hey, actually, it's not a golden ticket, man. Like, it's in a way
Yeah,
just a
it
job in a sense. But yeah, like
absolutely.
people
Yeah.
want to find fulfillment in their
Yeah.
work, and so this is where like the whole motherhood identity, you know, shift that comes in when you become a mom helps.
Mm,
It drops you out of what you were doing before, and then like,
really
hey,
wants, yeah,
actually, yeah, what do I really want to do? What do I really want to
yeah,
spend my time on? Because time is so
yeah.
scarce now with young kids, and yeah, so it's definitely sparked really interesting conversations. And like
Mm,
now I'm doing the series with coaches and counselors, who yeah focus on women, and then in that subset, working moms.
mm,
It's across all of them. Like the most common things that there's this change in identity, a fundamental change in identity towards how
yeah.
they think about their work after they have kids. Um, yeah, so that's where I landed, and am still in the midst of totally figuring out, but
Mm,
it's been a great experience. Yeah, and I hope
yeah.
you all will go and listen too.
Yeah. We're definitely gonna kind of put a link, when this episode goes out in terms of, where to find your episodes as well. I find those conversations really, interesting because, I have those conversations with my wife as well, like,
Yeah.
it's exactly what you've mentioned around how, the moment our son was born, then, it's all these questions around like, who am I really, right? And suddenly
Mm.
you realize you're not the same person anymore, and you're looking for a new way of being. Those are
Mm-hmm.
words that she used. It is
Oh
a common
yeah,
theme, like, trying
definitely.
to kind of, that sometimes, I mean, we love our son so much, but there are just logistical aspects, the chore aspect of it, that really isn't that fulfilling for everybody, right? I know of moms who, and dads who really love, preparing so many different types of stuff for their kids, right? For school, for food and stuff like that. But you know, it's not for everyone. It's not for me. Like, I
Yeah.
don't enjoy cooking that much. I love eating, but not so much cooking, and the variety that comes with it, right? So being it,
Yeah.
and that the options of being a full-time stay-at-home parent may not be on the table, because you just find
Hmm.
there's still other things that you're excited about, right? And that's something that people don't talk
Yeah.
about enough. You can both love
Yeah.
someone so much, your son so much, your daughter so much, but at the same time there are just aspects of it where you kind of need some me time and some identity to yourself as well. That kind of duality is really,
Yeah.
I feel like only parents, once you become a parent, you can fully understand it. You know.
There is, yeah, there is for sure an unsaid bond with parents, especially new parents, because we're both in the trenches together. I mean, our experience will be very different, but there's some core like shifts in you that you're like, oh my gosh, yeah, I get you, bro. So yeah, actually, that's why when I after we came back, because we had our first kid overseas without family and friends and all that,
Mm,
and it was it was during COVID, but we were so like blessed by people who we didn't really know so well. I mean, they were some people who were our neighbors, and some were from our church community. They would give us food, and they had set up this meal train, and it was so sweet because they were all also young parents or had been through before.
wow.
And
Yeah.
there was just like
Yeah.
like unity and a sense of camaraderie. And when we came back, whenever I hear there's a new baby, and even in my blog, like I actually cook something and give it to them, even though I don't really know them, because I'm
Oh
like,
wow.
hey man, I feel you. Yeah.
Yeah, and like, I wanted to kind of also, ask you one of this, question uh, that is related to what we talk about, like being, new parents and all that, right?
Yeah.
If you could write a letter to, working moms, what would the letter, be about? Yeah.
Yeah, that was a interesting question. I want to like rephrase it, or sort of
Yeah, go ahead.
think
Yeah,
about
yeah,
it in a slightly different way. So I'm thinking more about writing a letter to my younger self,
yeah. Mm,
um, or
cool.
my younger
Yeah.
working mom self,
Yeah, yeah,
if
yeah.
that's possible. So I thought about it. I think and it comes in two parts. There's the mom part, and then there's the working part. So to the mom part, I want to tell myself that yes, Sarah, it does feel like being a mom is like a subtractive kind of um, phase where I have less time to myself. I have, less time for my husband or things that I like to do. But essentially, it's additive. It actually, because of this new identity, it gives you new perspective into everything else. It's like a new lens that you're wearing. So, you will grow in empathy, like I was sharing for people who I don't even know, but because you're in the same stage, it's like, okay, let's, just show a little bit love and pay it forward. And then you learn to look at things through the eyes of a child, which is also so precious and such a short time, right? And it will also build your faith in God. So I really grew a lot in trusting God as well during that time. And that has been beautiful for me. So yeah, even though it's hard, it's acknowledge it. Don't feel like you need to have it all together. I know ultimately that you will be growing out of it. It's a process. So that's to the mom part, and then to the working part, which is the part that has been around longer. Give yourself more grace and more space. Don't try so hard to get it all together again from a professional side. Like, don't worry about gaps in your career, journey or your resume. Important thing is to know how to make sense of it, right? To explain and to almost like story tell about why that happened. And in fact, totally ditch the idea of a career ladder. I've always grown up with the idea that, it's one step after the next. It's like a mountain that you need to climb. That's not helpful, the idea of a career ladder. I don't even want to say like go at your own pace, because it sort of suggests like some kind of competition or a race. Dance to your own tune, enjoy yourself for the moment, lean into what you really are passionate for your work, and continue having a mindset of openness and growth with your working skills. So that's my love letter to my mom and my working part.
Wow, that's that's really wonderful. I could learn.
You cry?
I mean, I had some. I had some reflective moment for myself as well. I think the part around like being able to empathize for people, that's the first part that I realized for myself as well. Like now when I see a child that is throwing a tantrum and stuff like that, it used to be that, my goodness, what's the parent doing? And now it's like, oh, poor parent, like they must be having such a hard time. Because sometimes
Right?
you just cannot control those moments, and they are learning, and and I learned that they're not trying to make your life hard. They're really trying to learn how to overcome their own little big emotions as well. So that's kind of what my perspective kind of changed from that as well. And the part around the career ladder being extremely unhelpful, during these 3-4 months of me taking a career break, that has absolutely been not helpful. I found myself wondering to myself, like, what is the next step? And this next step better be a step above the ladder, and that has been really unhelpful. That has been really unhelpful. And no matter how much awareness that I have around, like, it's good to have your own pace, everybody goes at the right pace and stuff like that, do what is what you most needed for your phase of the career. It's all head knowledge, but it's not going here. It's not connecting. It's really not connecting to the heart and to the soul as well. Spiritually, I also believe that everything happens for a reason, and God's plan is better than yours, right? But it's hard. Right now, it's kind of like in the wilderness. You don't know what's going on as well. Yeah, you just gotta keep
Surround
going.
yourself
And
with good people and people who
absolutely,
will encourage and speak into that what you need at that point of time. And I'm so
Yeah,
glad
yeah.
we got to connect, Zen. I
Absolutely.
really wish you
I
all the
think this
best.
is, yeah, I wish you all the best as well. And, it's been a really great chat with you, Sarah. This is an episode that really hits all the three areas that this podcast kind of represents. And I'm very grateful for for this as well, and I'm so excited for what's ahead for you as well. So thank you so much for being on the show, Sarah.
Thank you, Zen. I'm rooting for you. You can do this.
Thank you.
See you.